Welcome to Pindar Poetry. We hope you learned something new.
You start by preparing both devices and your body. Charge the watch above 50% and confirm the phone app shows a live connection. This ensures data sync. Sit quietly for 5 minutes because movement and stress change readings. Once seated, rest your arm on a table and position the watch 1 to 2 centimeters above the wrist bone, snug but not tight. This optimizes sensor contact and reduces motion artifacts. Now tap the blood pressure function and begin the measurement when the watch prompts you. You must minimize variables while the device measures. Keep completely still, breathe normally, and do not talk. Even small movements distort the optical and pressure sensors. Make sure the sensor windows are clean and sit flat on skin because oils and gaps cause noisy readings. If your watch uses a cuff or inflatable strap, tighten it to a comfortable, firm fit, following on-screen instructions. The app will often show a real-time stability indicator. Once the measurement completes, allow the watch to process the data before moving. After the reading, save the result to the phone app and compare it against your baseline or a validated manual cuff reading, since smartwatches vary. You should repeat the test 1 to 2 times, waiting 1 to 2 minutes between attempts, and use the average for better accuracy. If readings are inconsistent or clearly off, recalibrate the watch per the manufacturer, recheck sensor placement, and confirm app permissions and firmware are current. This single troubleshooting step resolves most errors and improves future measurements.
Thanks for watching. Consider subscribing if we helped you.